When you wake up in the morning, it's not uncommon to find strands of hair on your pillow or your blanket. Now, according to the American Academy of Dermatologists, it's normal to lose actually 50 to 100 hair strands per day. They call this hair shedding. But then there is hair loss or alopecia, which is an entirely different thing. Hair loss is an autoimmune disease where we lose partial or large portions of our hair. Today, we will discuss what causes hair loss and how we can manage this condition. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. Our guests are here today to give insights on proper management and diagnosis of hair loss or alopecia. With us is Dr. Maria Rica Malyari. She's a dermatologist from the St. Luke's Medical Center and the head of the hair unit. Also with us is Dr. Angela Pineda. She's the Executive Vice President of Derm Clinic. I'll start the discussion with Doc Rica. Let's explain to our viewers kung paano malalaman na legitimate hair loss na ang problema natin. And not just the normal, as we mentioned earlier, may normal hair shedding. When is this hair loss na talaga?
Alopecia is a general term, so it can be hair shedding, presence of bald patches, or just parang gradual thinning. Every day, we normally shed hair. 100 strands a day, pwede pa yan eh. Our hair grows, it has a growing cycle, grows 3 to 5 years, sometimes 7, and then it dies, and it sits there and waits for a new hair to grow from the same root. So the new hair will push the dead hair out, and the dead hair will fall off. So that's the normal hair cycle. But if there are times wherein it's not just 10% of hairs that fall, it's about 30 to 40%, and there are different causes of that. That's not normal already. Sometimes it's because of you gave birth, you got sick. Now, common because of COVID, dengue, there's a hair fall because of that.
Okay, now I'd like to ask Doc Angela, when it comes to hair loss, maraming factors talaga yan. There's genetic, there's probably trauma for that matter. Even stress can be a reason for hair loss. But here in the Philippines, what are some of the more common reasons kung bakit nagkaka-alopecia or hair loss ang isang tao?
Usually, yung most common, yung androgenetic alopecia. Yun yung most common worldwide. Yun yung tinatawag natin na it's known as the male pattern, or for females, female pattern hair loss. So, I think in the US, siguro mga 50 to 80 million agad yung affected. And sa atin, malaking percentage din na most of the cases, it's because of alopecia.
Kung yung parents ninyo, you see at a certain point na they had hair loss, most likely you may have that as well. But I'd like to ask, Dr. Angela, when it comes to hair products, maraming naniniwala, ay madalas kang mag-hair gel or masyadong makapit ang hair products na nilalagay mo. Can this be a cause for true hair loss or alopecia?
It's multifactorial pa din for hair loss, but it's mainly genetic. So usually, when we consider the androgenetic alopecia, namana mo na siya or makikita mo it's in your family line. Like for males, you'd see na mas mataas or tumataas yung or receding yung hairline. Secondly, would be dito sa back area, or usually yun yung area na affected. For females naman, it's a little more different. So usually, it's for the whole area of the scalp na nakapapansin mo siyang unti-unting numinipis, or particularly dito dun sa middle area na parang lumalapad yung scalp area. So yun yung usual common na nakikita. But for mga hair products, there are habits or hair habits that we do that can aggravate or can trigger para hindi maganda yung maging environment on the scalp. So it's not necessarily naman na may cause talaga yung hair gel, but sometimes we need to be wary as well of how we use the hair products.
So after the break, we'll discuss the impact of hair loss on our mental well-being. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. How big of an impact is hair loss to someone's confidence, be able to sociable for that matter? And why is this so? What are some of the main reasons why the confidence of some person who has hair loss is high while others may be very low?
We all know our hair is our crowning glory. When we wake up in the morning, we look at ourselves in the mirror and then we try to fix our hair. And it makes us feel good when it looks good. That's why we have it permed, straightened, colored, and we do stuff with it. Yung hair and makeup, di ba? Every time we attend a function, do hair and makeup. It matters. It makes you look pretty or handsome. So it really is important for most people. And once the person starts losing hair or thins out, it really becomes a problem. I have some patients who stopped school, who stopped going to work just because of their hair thinning.
Now, Dr. Angela, let's talk about some of the other reasons. You said the more common one is the androgenic alopecia, or something that is genetic, or namamana. Now, let's talk about stress. Let's talk about something that's very difficult emotionally for someone. Can this be a cause for acute hair loss?
Alopecia areata. So yun yung, it appears like there's area of your scalp that's bald. So magmumukha siyang parang it's moth-eaten, or there are areas na maliit lang na patch. It can be range from like 1 centimeter, it's very small, or it can be as big as 3 to 5 inches. So it can be really very big, but it's usually mainly caused by stress. Usually for these kinds of patients, we advise them that it's mainly temporary. It's like the response of the body. It's an autoimmune response wherein it somehow attacks its own cells. But there are tips and there are guidelines that we usually recommend so that they can recover quickly.
Some people, when they see it pass, they'll just wait several months, it grows back on its own. Is this the proper way to address alopecia areata?
Better to have yourself checked by the dermatologist because it can be from other causes. So it has to be determined. Like bald patches can be alopecia areata. It can be trichotillomania. It can be from other causes. So it has to be assessed. So the proper management will be done.
There are so many emotions that come about. Should the hair loss due to treatment, specifically chemotherapy, be addressed? Or is this something part and parcel of the treatment?
For patients with cancer undergoing chemotherapy, they know already that they will be losing hair. So sometimes they're anxious about it. But there are some treatments nowadays, chemotherapeutic agents that don't cause hair fall. So maybe they could ask their oncologist, the cancer doctor, if there's a possibility that they can use some agents that would not cause the hair fall. But if ever they would experience that while waiting for the hair to grow back, because it will grow back naman, it will grow back. Mm-hmm. So just try to enjoy it. Wear caps, wear nice bandanas, scarves. Try to look beautiful and feel beautiful even without the hair. You can do many things like camouflage and join support groups because it helps also. There's this in the hospitals where they undergo chemotherapy. Sometimes there are support groups there. Cancer patients go together. They work on some art or they do things together. And there's also Alopecia Philippines, a big group of patients with hair loss here in the Philippines, and they also have this support group where they help each other, encourage each other.
Now coming up, we'll discuss treatments available in the Philippines to help you or your loved ones manage hair loss. Only here on MedTalk Health Talk. Welcome back to MedTalk Health Talk. We have been discussing how to manage having hair loss. Dr. Angela, let's talk about how a certain type of alopecia is properly diagnosed. What are some of the steps? Are there any tests to be done?
The number one is the history, so that we can learn if it's chronic, if it's longer than 6 months, or if there are other factors, or if there are systemic illnesses that can affect it. Secondly, we do a physical examination so that we can check the origin. If they're like if it's trichotillomania, it looks different. The hair looks different compared to when there are other causes. So those are the major tests or the initial tests that are usually done.
In terms of least invasive, what's some of the options available for those with alopecia?
Alopecia kasi can be anything, can be caused by anything. So there are topical medications. If it's caused by an infection, fungal infection, bacterial infection. So there are topical medications, oral medications. If it's your genetic thing, if it's alopecia areata, there are some injections that are available, oral medications also. For trichotillomania, sometimes you have to refer to a psychiatrist for control. So there are different forms of management. But if it's your genetic thinning, like your pattern hair loss, aside from the topical medications that you can apply, there are oral medications and procedures to be done, like your hair transplant. There's a the injection of your growth factors on your scalp.
Now, Dr. Angela, when it comes to other topicals na pinapahid sa ulo, what is currently the most effective or has a significant effect on improving hair growth?
I think the most effective is really minoxidil. It's proven over, I guess, a number of decades already. It's still the only one that's FDA approved in terms of being able to really control or somehow manage or treat hair loss. And for the use of minoxidil, usually it's recommended for males and females. It's used twice a day. And then it's usually observed since hair growth is longer, so it also takes a long time for treatment. So usually you don't really expect results within a month. You usually follow through up to, so you start seeing results maybe 3 to 4 months on, and then you keep using the medications just to see better results.
When it comes to hair apparatuses, wigs, toupees, when is this the best option in trying to manage hair loss?
It's more of us wanting to remember like we have thicker hair. But I guess if, for example, you feel like you need to supplement that with you having to see that you have physical hair on your head, then that's when you can really use it. But it's really dependent because you see some patients naman who know that as long as they understand that in a couple of months I'll grow this back if they have cancer. Or there are some naman who just wait on the process. Then there's no need naman to wear toupees. But for those who really want to look or have a boost in their self-confidence, those are some who really look into wearing wigs and looking for, it's somehow therapeutic for some of the patients that we see.
Now, going on to the more invasive procedures, which is hair transplant, Dr. Rica, please talk about this. When is this a viable option for someone? At what stage of their hair loss? Give us some more information about this, please.
Hair transplant actually is done when the patient really wants it done. And usually we do it on the frontal area because on the frontal area, the bitemporal recession that you notice on the receding hairline, it's what's commonly called, that one will not grow quickly, even with the medications, topical or oral medications, it will not grow back. So it's better to do a hair transplant on that area. But you have to tell the patient how it is, because some people, when they hear of hair transplant, they think you just transfer the hair there. It's not a surgical procedure. Actually, it's a surgical procedure. You get a piece of scalp on the back, a strip, or it could also be follicular. You get each hair follicle from different parts of the hair on the back, and then you transfer it in the front. So it's a surgical procedure that's done. And the patient has to agree that to it because it's a bit expensive.
The visual effect of it, is it indistinguishable from hair that normally grows? And can the activities of someone who has undergone hair transplant do the same activities as they had when they had hair? Swimming, wearing caps, wearing helmets, all of these.
You can do anything normally because it will grow like your normal hair. So
Okay. And that's
as long as the grafts don't fall, because sometimes even immediately after the procedure or maybe until 2 weeks, you are not allowed to go swimming, do strenuous activities to make the
Okay.
hair strand settle down.
So it's a normal process, and it's good that our viewers know some of the expectations for this to get the maximum results. Now, before we go, Dr. Angela, do you have any tips or advice for our viewers, especially when it comes to hair loss?
I think for hair loss, the number one thing that we want to do is that we understand the cause or we understand the reason for it so that we know how to address it. So that's also our advice to our patients so that they don't panic immediately. Secondly, it's important for you to see your doctor so that they can help you understand more. They can help you walk through the process of how to recover it if it's still recoverable. And thirdly, I guess another thing that's important, since we discussed a lot of treatment options, is that they learn to understand where they're at in terms of accepting hair loss or in terms of their eagerness to go to the most extreme procedures or so, and the relevance that it would affect their lives.
And of course, Dr. Rica, before you go, any tips or advice for our viewers?
Well, aside from that, probably eat a healthy, balanced diet, because sometimes when you go on diets, the hair falls also. And if you're going to use hair products on your hair, not too frequently, even the procedures that you do, like the hair straightening, hair perming, you do it as far away as possible, even the hair coloring, so that the chemicals will not destroy your hair strands. And if you start losing hair, you start noticing that there are bald patches or just a hair fall that's not usual, it's better to go to a board-certified dermatologist to have it checked, so you will know what it is and what to do, so you won't panic.
Very good advice. And with that, thank you very much, Dr. Angela Pineda and Dr. Maria Rica Malyari, for being with us today, sharing your expertise about managing hair loss. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.